Through the York Hospital Robotic Surgery Program, WellSpan has coupled leading-edge technology with highly skilled surgeons and clinical staff to offer residents of South Central Pennsylvania and Northern Maryland a minimally invasive alternative to major gynecologic surgery.
Traditional hysterectomies are done in one of two ways. One can either do a vaginal hysterectomy or an abdominal hysterectomy. A vaginal hysterectomy implies that there are no abdominal incisions and the entire operation is done through the vagina, and after the uterus is removed, the top of the vaginal wall is closed. So that is really the ideal way of doing a hysterectomy and the least traumatic.
Traditional open gynecologic surgery uses a large 6 to 12-inch incision in either a bikini cut style or in the midline from the pubic area up to the belly button or even above. This type of open surgery can mean significant pain, a long recovery process, and involves the surrounding organs and nerves. Robot-assisted surgery with the Da Vinci surgical system uses several small incisions under a half-inch each. It is through these incisions that the surgeon introduces the surgical devices in camera, which offer greater precision and control for the surgery. These smaller incisions and the way the surgery is performed offer women numerous potential benefits over traditional surgical approaches. The Da Vinci system's ergonomic design allows the surgeon to operate from a comfortable seated position at the console. Here, the surgeon views an actual image of the surgical field while operating in real time. To move the instruments at the ends of the robotic arms on the patient cart, the surgeon simply moves his or her hands. The endoscopic camera is controlled by the surgeon's arm movements and the use of foot pedals. The robot cannot make decisions, nor can it perform any type of movement or maneuver without the surgeon's direct input. The system's controls translate the surgeon's movements to the endo-wrist instruments. These instruments are much smaller than traditional surgical instruments, and their jointed wrist design exceeds the natural range of motion of the human hand. Their size and versatility allows the surgeon to perform tasks with greater precision and contributes to a reduced risk of complications for the patient.
After a patient has had an abdominal traditional hysterectomy, that patient generally stays in the hospital anywhere between 2 to 4 days. The recovery time often is between 4 and 6 weeks, often approaching 6 weeks. With a Da Vinci hysterectomy, after 1 week, I tell the patients that they may do almost anything that they wish.
When I went up to my room after recovery, I found it a little interesting that the nurses and the different assistants were coming in and saying, what type of surgery did you have? And I told them that I had a hysterectomy, and I said that I had the Da Vinci surgery, and they were amazed that I was sitting up in bed, that I was getting in and out of bed, that I ordered my supper to eat, and this was only within a few hours. My expectations were definitely exceeded because all of the recovery time was even shorter than what I had anticipated in my own mind, and I was back to work rather quickly and with no limitations.
With the Da Vinci and the technology of the Da Vinci, the visibility that we have, the wristed instruments, the power sources, the advanced electrosurgical power sources that we have, we can operate for conditions which are really quite complex.
A lot of people came up to me and said, what are you doing? Why are you attending this function or whatever? You just had surgery. And then hearing their stories of the traditional procedures and what they went through and what I was experiencing were really, to me, night and day. And I was glad that I chose what I chose, the Da Vinci.